This is Dr. Brad. So you're not going to want to miss this. It's just this conversation just keeps getting better and better and better. So we're going to jump in again right here.
Yeah, I mean, I give you a lot of credit. It's very commendable the way that you conduct yourself and carry yourself. I think that, again, I'm out of my element here. I don't know this stuff that well. From a layperson's perspective, I think of the system more than the practitioner, right? So I think of the fact that, okay, so when you go to Best Buy and you need to buy a brand new TV, a big TV that's going to cost you a few $1,000s, there's a price tag there, right? And you talk to the sales associate and you figure out what the price is. Maybe there's a coupon, maybe there's a discount, but you know what that price is, and you go to the register and you pay for that thing, and then you bring it home. The challenge with, I guess what I'm getting at here with the system, and I'm not trying to use that term, the system, too broadly, right, is just sort of the paradigm or the frame of the doctor's office is there are no prices. There's no price tags, right? So when you come in, like we are as patients, we are not trained to ask those three questions. And I would assume that the medical industry, the medical insurance industry does not really want us to ask those questions, because if we did, it might lead to different outcomes,
Well, the insurance has destroyed healthcare. There's no such thing as healthcare, but it destroyed it. And it's manipulated the doctors into just being technicians, which puts them in a huge place because other people tell them what to do, what they can and what they can't do. And with the liabilities that are attached, that's scary. When somebody else is telling you something that you have to do that can destroy you, that's pretty sobering as far as that goes. But you can't get health inside of that. They reduced the average medical doctor visit down to 6 minutes. We had an administrator in a research hospital, one of the big ones. I don't remember what hospital it was. I just remember the talk. So the doctor comes to your room. They're outside. They pull the chart out. And they're looking at the chart and they're formulating what their idea of what the problem is. They got some ideas within a few seconds. Within 30 seconds, they've already got their diagnosis and they're working on their treatment plan. They haven't even come in and talked to you. They don't open the door till they already have their treatment plan in mind. And it's not much over a minute they've spent outside. And they walk in, all the rest of the time they spent with you is fluff.
Yeah, it's scary.
That's sobering, isn't it?
It certainly is. And again, I don't have enough experience, know-how I certainly don't have enough knowledge to say it should be this other way, and here I'm going to put all the policies in place. But I do, I've read enough to be able to say it's clearly a bit broken, and I would like somebody to find a solution.
Yeah, you look at yourself. You cannot help somebody that you can't sit down with, take a survey of history, and try and assess what in the world's going on. That takes time. Doctors aren't paid for that, so they don't.
Yeah.
And that's the basic broken link right there.
Yeah, absolutely. And I mean, thinking about the mental health stuff, right, is, look, if somebody is in a dire place and needs to be put on medication right away, then you do that. The challenge is, we have these short windows where, maybe you have a psychiatrist appointment and it's 48 minutes long because it's an hour, but the doctor needs 12 minutes to write up notes or whatever, right?
Right.
In that 48-minute window, rather than saying necessarily, and I'm not trying to criticize all psychiatrists. There are obviously some really good ones out there. But there's also some bad ones out there. And so in that 48 minutes, a quote-unquote not amazing psychiatrist may say, hey, thanks for your story, not going to listen to it any further, here are the pills, right? And so with anything that we're working on, as you said, like trying to get to the root of the issue, these things do take time, whether it's on the mental side, the physical side, whatever. I don't know if it just comes down to these things are just too expensive and we can't afford to spend the time and do the research. But at the same time, I also think to myself, how can we not afford to? Because if we provide a solution too quickly and that solution isn't a good one, we're going to create other problems downstream. And so that's certainly not good either.
The keys generally are in the history. And without history, you have no concept. All you're doing is trying to pacify a symptom. But you've got to spend time in the history to find root cause or the lifestyle issues that are making this whole thing manifest itself. In whatever is going on, it takes time. And it's just not a negotiable option to regain health. You can't bypass the time factor.
Yeah, it's hard. And I think to try to make things a little bit more concrete here, I would say I have, and I'm not looking for a diagnosis, so don't worry, but at least on this conversation. So like a few years ago, I started getting like nerve pains in my hands and feet, like shooting pain that would hurt a lot. And they're short, but they would happen, sometimes upwards of like 30 times a day. And then on top of that, I'd just have like weird neurological issues, whereas like I would sometimes dissociate or feel like things weren't real. So I'd get like derealization. I'd get heart palpitations. I couldn't necessarily, like I'd get brain fog. I couldn't always, do my work, that sort of thing. Really tired, whatever. And so I called my doctor and I was like, hey, I'm experiencing these different symptoms. What do you think? Like, should we run blood work? Should we do this? Should we do that? And he's like, no, I think you're just stressed out. And I was like, really, dude? Like, this is really distressing. I'm having a hard time going through this right now, and I don't know what to do. And he's like, no, you're good. And so I went and I had no idea who to turn to, what to turn to, whatever. I went out, I bought my own blood work. I did one of those full body MRIs because I'm thinking my brain is going to explode or my nerves. I don't know the human body that well, or I knew it even less a couple of years ago, but started paying for all these tests trying to figure out what was going on. And I think kind of to what you were saying a minute ago, right, is like you have to do that research, you have to do the work, you have to think about the lifestyle, you have to think about the history. And I would I'd call my doctor back and I'd be like, yeah, things still aren't good. It's been a couple months. I'm still having these symptoms, whatever. And he'd be like, nah, you're just stressed out. Like, do some meditation or whatever. And I'm like, oh my goodness. Like, this is crazy. I'm trying to get to the bottom of this. And then I went in and I was like, hey, doc. So, I did, I went out, paid for my own blood work. I did an MRI, whatever. And he's like, oh man, you're lucky they didn't find like a false positive because that can be really bad. And I was like, what is going on? Like, I feel like I'm taking crazy pills, And so I still don't have the root cause of that. But what I would say is it has led me on a journey of, going from thinking I have my mental health totally covered and figured out because of my past experiences and the books I've written and all that, to being on this new journey of saying, okay, let me rebuild every part of my life and take stock of things and figure out, where may these symptoms be emanating from and what could I do about them? And so, I mentioned earlier on the show that I downloaded that app Chronometer and started logging all my food. So I basically rebuilt my entire diet or started eating completely differently, like basically no packaged foods anymore or very minimal amounts of packaged foods. I try to eat mostly stuff that vegetables, fruits, meats, things that either I prepare or I sort of know how they're prepared somewhere, like simply prepared, if you will, not something that's processed and fried and all of that. And I haven't necessarily gotten to the root of the issue, but my theory is that it's probably complete nervous system dysregulation after years and years of immense stress and a bad diet. And so I think my theory is that, my nervous system is just in this spot where anything that's small can push it off kilter. And as soon as I fall into that dysregulated state, the symptoms come back. And so part of me is like, hey, maybe there was an element of what my doctor said that may have been right of the stressed out piece, or probably was. But also I know that if I just went and meditated, that wasn't going to solve the problem, right? I had to change the way I lived my life. I had to change the way that I reacted to different stressors in my life. And I also know that hey, this week I'm doing good with this stuff. Maybe next week won't be as good, and I'm going to have to keep digging and figure things out. But that's the kind of process that I try to bring to things in my life, right? To bring an
And that's
experimental
a
approach and
proper
get to the root of
process.
things.
The one problem that we always have is we're blind to the things inside of us. You look at that in every aspect: mental health, relational health, financial health. You look at all of these different things that are out there. We do what we're familiar with, not necessarily what's logical or reasonable, that you would really pencil out with different things. And we just don't have the ability to evaluate ourselves. When you look at the information age out there, I call it YouTube PhDs. I said that one of my brothers just fell off his chair. He goes, I'm gonna write that one down. You got all this information that people can go plug in. YouTube's a big one to go find something out, but there's no foundation of understanding on how to apply that. And it creates this, what I call YouTube PhD, these people that know all kinds of stuff, but they're not processing properly because they don't have the foundation to deal with it. And that's generally when you're in a place like where you are. You're talking about metabolic issues, but since you don't understand how physiology works, you're not going to be able to see those because you don't have that critical 60,000 foot observational view to be able to separate yourself from the problem and look at it from this global perspective, because you don't have the foundation there. And it's the same thing that everybody does. I was 5 years old in an emergency room in the hospital when I'm in the same place. Gut wrenching pain woke me up in the middle of the night, and I'm, what's going on? Doctor just does this weird rectal thing to me, says this will make you feel better. What?
Yikes.
What's going on? And I'm 5 years old, but that's really strange. And I don't remember how many visits I had to the hospital after that, but no, this is what's doing it, this is how you avoid it, this is what's going on. Nothing, just I'm going to pacify your symptom and go home, go back to bed. And those answers aren't adequate for what's going on with people like you and all these chronic health problems that are out there. They're just not adequate. Oftentimes the answer is a lot simpler than what people think, and it takes coaching to bring people through all those things. But that's one of the biggest things that's out there, is we need to approach things from a whole different mechanism to really get the answers, because the research won't look at it from a causation standpoint.
Yeah, it is really fascinating to think about it. One thing that I often kind of blows my mind, even though it's really simple, is there, maybe there's eccentricities that people have, little tics that they have or whatever. And it might even just be things that they do that are harmless.
It's called bio-individuality. Though we may look similar, what's going on inside varies widely from one person to another, even the same household.
Yeah, and I think also, to me, what's most fascinating is most of us, like you said, can't see it and have no idea that we're doing it, right? And so it can be jarring when, for example, let's say that, when I finished all my sentences, I did some hand motion, or I made some sort of, some other additional sound or whatever. And one of my friends says, you always do that thing. When you finish a sentence, you always wave your hand like that or whatever. And because you can't see it and you don't know that you're doing it, the first reaction is, I don't do that. What are you talking about? Right? Sort of an indignation. But it's fascinating because to other people, it's so obvious. We just can't see outside of ourselves. And so I remember I was working with a coach a long time ago. Yeah, I was probably 22, 23. And I was a little bit more full of piss and vinegar or whatever. And I was frustrated that it cost a lot. And I was like, I don't need a coach. Like, I don't know if I'm getting anywhere, whatever. And I'm not saying that that was necessarily the right coach or the right experience, but he said something that is right in line with what I'm talking about that has stuck with me to today, which is, he's like, dude, I'm not saying I'm perfect. I'm a professional. I know everything. I'm saying that every human could use the voice of a coach because you cannot see outside of yourself. And so I can tell you things that you cannot see. And to me, that blows my mind.
Yeah. You talk about these familial patterns. Doing podcasts, I'm on video quite a bit. And there's some different facial expressions, different way I move, different way I do some different things that I see in one of my brothers or my father, which is kind of a surprising thing to me, because we weren't a family that was really close. It's just one of those inherent things that is part of your character. And we have so many things like that we just don't know we're doing.
Yeah, and finally going on video reveals it to you. We need modern technology for that.
Yeah, so it's been pretty amazing. We should wind this down. I don't think we ever really got to what you were thinking about your subject. I think it would be good to just follow a link. I can send it back to you. Schedule another one. We can probably get more to what your subject matter is. I think this has been a dynamic conversation. I think it's been a very valuable one. But I think you have more on your plate that you'd really like to get to that we didn't, and that wasn't intentional. I like organic conversations, and a word takes something one way or another. I think you get taken that way. A good friend of mine was a pastor of mine for a while, and he'd be speaking of something, I'd hear a word, and I'd pull out my Bible and I'd write out an outline for a sermon or a message or something like that, and then finish that out, and I'd keep back into what he's saying. He'd say another word, and then off on another tangent and write out another outline for another one. And by the time he's done, he says another one. I got 3 outlines for profound messages. No idea what he talked about. God's talking to me. He's giving me all these revelations off of this and taking me off this stuff. And I tell him that my wife's pissed off, and he goes, "Well, at least somebody's getting something out of what I'm saying."
Nice. Yeah, it's cool. And I certainly would love to do another one. We could talk more about mental health stuff. But it's funny too, where earlier on in the conversation you said I like organic conversation. I like to see where things go, and all of this stuff is, I read a lot of information, whether, books or journal articles, Substack articles, whatever. I'm like fascinated by all this stuff. And a lot of it was it was the child or whatever. It was the result of me going through, my own mental health issues and my own physical issues and trying to get to the root of some of those things and just digging and digging and digging. And eventually it's like, I didn't plan on learning much about nutrition, but here we are, so I am passionate about this stuff. I like talking about it, and especially with folks like yourself who know a lot about it and more than I do. It was definitely a fun conversation.
Yeah. Well, all right. I'm gonna close this one off. Well, this is Dr. Brad. Thanks for joining us through this session with Brian Sachetta. This has been a really, really dynamic talk. It's been really good. We covered so many aspects in mental health that generally aren't dialogued about from people with much experience. As typically from the mental health side, there's a view through all the literature and all the ways of viewing things. And from the more physical health side, they usually don't come into this dialogue. And that piece of the puzzle is just completely missing. That really brings dynamic depth to the whole conversation and a much more global understanding. So share this one with your friends. Put a review on. Help us get more interest in this channel, because we're really covering some subjects in ways that just don't cover very much. So we release these every Monday and Thursday. We'll see you guys for the next one. Thanks. Have a great day. Bye.